Solving the fertility issues, it's like creating a puzzle. And until you know that all pieces are there and you completed them, you cannot be sure that you get all the answers.
I'm Alice, and this is IVF Off The Clock. Today I'm here in Dublin to speak with Dr Uliana, who came here from Bratislava.
It's a pleasure to be here, and thank you for having me in such a wonderful environment, absolutely special, but very, very Irish. So I'm Uliana Dorofeyeva. I'm IVF specialist with a background of almost 20 years right now. Actually, my professional journey, I may say, started in Dublin because in 2007, I came here as a very young doctor, general gynecologist, without like a deep knowledge in IVF, as there was a clinic who used to collaborate with Ukrainian facility where I was working for 16 years afterwards, and they were shipping sperm into our country and looking for the oocyte donation. So we were responsible to recruit donors, stimulate donors, create embryos, and then send them over here to Dublin. And once the clinic became very busy and the program was very, very active, the clinic from Ireland, they were looking for their ears, eyes, and hands in the Ukrainian facility. And I was chosen as a young doctor, knowing English and being absolutely open to learn everything else. And I spent here around 6 months in general, in total, like coming back and forth under the wonderful supervision of the experienced physicians, quality managers, lab staff, etc. And this was my first experience of learning deeply the fertility sphere, especially third-party reproduction, quality management, etc. Since that time, I think that was the game changer in my career. I learned about the opportunities of what does it mean to be a fertility doctor, what actually the field brings to the patients globally, not only patients in one society or one country. And since that time, I'm really helping patients all over the globe. It's a long time. A lot of things changed, even in Ireland. And it was a wonderful experience to spend this weekend here with people I knew for many, many years. And even meeting our patients from back 10, 15 years ago, and very fresh, like very new patients who just joined our new facilities because everything changed obviously for my career. I'm Ukrainian and I used to work in Ukraine for 16 years, as I said. However, last 4 years we are in Europe, and we also have many facilities right now, 4 different geographical locations, including Ukraine, Slovakia, Georgia, and the partner clinic in Albania. So this is how we continue doing what we started to do about 20 years ago.
Yeah, so it sounds like you've been in fertility treatment for a long time now and you're very experienced. I wonder, are there still things that inspire you or excite you about this field?
Absolutely, yes. So I know that the fertility is a very complex journey, starting from the testing or motivation for the patients, like why they want to become parents, if they are sure about their decision, what is their problem, if this is a single and a simple problem, or it's a complex issue. And very often it's really a complex issue. And solving the fertility issues, it's like creating a puzzle. And until you know that all pieces are there and you completed them, you cannot be sure that you get all the answers. And sometimes longer we are with our patients, more we are experienced in completing their puzzles. And the puzzle may become bigger and bigger because we think that we already completed it, but then there is another angle and we still need to go deeper and to see in what's going on there. And from another side, fertility, it's something like it's a field still very young because the very first fertility baby just was born less than 50 years ago. And since that time, we are opening new and new horizons. There are a lot of innovation techniques and a lot of treatments which can be still considered to be experimental, but starting from the supplements, let's say, and different adds-on in this fertility field, confirming with something what has been proven and what has a very strong evidence. However, of course, because we are young, field in the medicine, we are still not having all the answers. But if you are open as a physician, as the professional, if you are reading a lot, if you are not afraid of trying new things, but which you trust and which you have evidence, either this is the animal models or the clinical trials, like just the first level clinical trials, and patients trust and they understand that you take care about the safety of all the approaches which you as a clinician are responsible to make these decisions, that's something what helps to complete the puzzle and to help to solve the issue of the infertility for our patients. That's what really motivates me.
It's really interesting. And I'm curious, how do you go about solving that puzzle with patients? How does it look like?
So it's systemic way of thinking, of asking questions, of analyzing the patient's stories and their fertility journey, their anamnesis. Sometimes it's coming from the inherited problems, like their fathers, their families, their sisters, their brothers, etc. So we know that genetics has a sometimes very crucial role, and if we are lacking this information, we may not see like a huge real options, like or huge questions which we need to solve. Then this is the experience of the patient with themselves. So they need to, like we as a clinical team, like I'm not the only one, of course, like that's something what really matters, that it should be a group of experts who are working together to solve the puzzle. And specifically experts who should be in this journey, that should be a clinician who helps to understand the female as the complex mechanism, urologist or andrologist who is taking care about male, because we cannot just get a cell. We need to understand what's inside the cell and how it works. And then the embryologist, because embryology is the heart of this treatment and of the whole journey. So it should not be closed doors. It should be an open door of understanding the processes, what is happening in the lab, and how we can effectively help the patient. So if all these professionals are aligned on the clinical case, if they are aware about the missing puzzles, and if they are willing to answer the questions and find real reasons, so this is how we can cover how we can get the answers, how we can cover the questions, how we can complete the puzzle and really effectively help our patients.
Yeah, so it sounds like it might not be a matter of looking at things in isolation, but how everything might be connected and affect itself. And it sounds like it's a really team effort, trying to find the right answers for patients, the right protocols. Yeah. Do you have any areas of specialty within fertility medicine?
So I'm an IVF doctor, gynecologist, and I know in some countries there is one doctor who can do both, including gynecology and embryology. This is not our practice. When I was in Ireland a long time ago, I know doctors here, they used to do also sedation. So it's an anesthesiologist and a gynecologist in one, but also this is not my specialty. So I'm focused on really diagnosis of the patient and then creating the best stimulation approach or the protocol to understand the ovaries, to understand their function, to understand their potential. My interest is in the ovarian rejuvenation. Many of my patients, they are advanced maternal age. And although we know the statistics and we are forced to say that patients should become parents being younger, but we know this is not the case very often, or often it's absolutely not the case, because many of our patients are over 40, even some of them, they are over 45, and they are very different. So of course they are at the stage of the decline of their fertility potential, and there is a statistical data, but still they are very, very individual. And sometimes we are seeing patients who are better responders or lower responders, and we need to offer them the solution. So ovarian rejuvenation, as I said, this is one of my field of interests. And I made my PhD on the ovarian rejuvenation in I completed it in 2021 or 2022. So in that time, I worked on the PRP as the single available solution in that time. Right now, we should not say that the ovarian rejuvenation equal to PRP. We have more complex and more innovative and deeper solutions for the ovarian rejuvenation, including the exosomes, adipose-derived stem cell treatment, stem cells themselves. We just need to have a proper collaboration if you're talking about stem cell solutions. So that should be a reliable stem cell bank where we can get the rejuvenating materials from. And then we need to understand the patient response, which is coming from the ovarian reserve itself and the hormonal profile of the patient. And the genetic profile of the patient should not be also like it's a very big part of the process. If we are missing genetics for some of the patients, we are not having the complete puzzle, even in the way of the ovarian rejuvenation. So that's something what is in my interest. Another field of the interest, that's the mitochondrial replacement treatment. But here, from the position of the gynecologist, we can do little. Our responsibility is to bring the eggs into the lab. And then the true science, some patients, they call this miracle, but we call this true science is happening in the lab. So this is how we can help patients of advanced maternal age to be effective, successful, using their own DNA.
That's really interesting. That's, I think, still quite a rare procedure, and it's not available in many places. I wonder, who is this procedure usually recommended for? What patients ask about that?
If you're talking about mitochondrial replacement treatment, then this technology has been approved and it's totally legal, for example, in the UK since 2016 for patients who are carriers of the mitochondrial disorders. But this category of patients, that's a very rare group. And thanks God, we don't have so many patients being carriers of the mitochondrial diseases. And this is the primary mitochondrial disorder. But for instance, there are much bigger group of patients who have the secondary mitochondrial disorder, which is related to age. Age is one of the factors which really brings a huge decline in the potential of the oocyte as the cell, because oocyte serves as the environment where fertilization is happening and the whole embryonic development as well. So this cell should provide food and energy for the potential embryo to grow into. And if the cell does not have the proper environment, not proper energy, not proper food available there, the development of the embryo cannot be as successful as it can be. So what MRT is for, to exchange the nuclear environment from the advanced maternal age cell into the 20-year younger and healthier cell, and using the most effective environment, the genetic material is developing better and we are having increased results in terms of the blastulation, and even we can impact the levels of the euploidity.
Yeah, that's really interesting. So it allows the patient to use their own genetic material, but still use the better quality eggs coming from a younger donor.
Yeah, correct.
Yeah.